Hi everyone, I'm Christina. I'm a registered nurse and lactation consultant that works for Horizon Health Network. I primarily work in labor and delivery and the neonatal intensive care unit. This is Kelly.
I'm Kelly Terrace. I'm a registered nurse and lactation consultant here at Horizon Health. I primarily work in the maternity discharge clinic here at the Moncton Hospital and the breastfeeding clinic here at the Moncton Hospital. So glad to see you guys.
So we're trying something new today. Neither of us have really ever done Facebook Live before, so please be patient with us, but we're hoping we'll be able to get you some really great breastfeeding info today. Feel free to post your questions in the comments. We'll try to get to them as soon as we can. And just to kind of get things started off, we have some questions that people sent in a little bit earlier, and so we'll start off with those questions, all right? Great. So one of the first questions, something that we get often is, how can I prepare for breastfeeding during my pregnancy and even before I come into the hospital? So what would you say, Kelly?
Well, it's pretty simple. You don't really need to do a lot of prep with your body or anything like that. But one thing that we recommend is, especially if you're a first-time mom, is certainly to attend a prenatal breastfeeding class. There's usually some in each city or town or wherever you're going to be having your baby. So attending a prenatal breastfeeding class is great. There's often great books out there and good information online. Another thing that is great is to talk to your partner about how he or she is going to support you through this endeavor, and also grandparents and family members and how they can support you, because it's just not the mom who's breastfeeding the baby, it's those around her who are supporting her and the new baby.
Yeah, definitely. Becoming informed. There's lots of really credible websites. You can go to the GNB website, and they have some links to a variety of like really credible breastfeeding resources that you can use. And so just, checking things out, even talking to friends that you know that have breastfed before. A lot of times those are going to be your best allies when you have different questions and stuff. So just letting the people around you know that this is what your intention is. And of course, talking to your primary healthcare provider, so whoever's following your pregnancy, whether it be a family doctor, a midwife, or an obstetrician, so letting them know what your intentions are, and they can hook you up with some good resources if you have questions and stuff as well.
Perfect. We have a question coming in?
We have our first question.
Awesome.
Okay, so her question is that after taking fenugreek and blessed thistle to increase her supply, when do I stop, or do I continue to use them long term?
Okay, so what she's asking about is there's different things in different cultures that sometimes people will use to help increase milk production. And she's talking about a couple of herbs that some people have found may have helped increase milk production. So if she's found they've worked for her, a lot of women will continue on with them for a little while, and then often if they feel things are going well, they'll decrease and wean off of those herbs as needed, and go from there. We always say continue to drink lots of fluids and things like that as well to keep yourself well hydrated. And but if you have any questions, certainly call a local lactation consultant as well. But maybe some people continue on with them throughout the entire time, but many people are able to wean off of them over time.
Yeah, but there's no harm in continuing on them long term, right?
No, there's not, unless you're having, as long as you're not having any side effects.
Okay, super. Okay, so another question that came in kind of from sort of early pregnancy is, what changes can parents expect in their bodies during pregnancy and in the early days after they've given birth?
So after early pregnancy first?
Yeah, body and pregnancy, and then in the early days.
So some women do not notice a whole lot of changes. Other women notice a lot of changes. And sometimes in the first few early weeks and months, some women will notice some growth in their breasts. Some women don't. Some women notice that their nipples and areolas will darken a little bit. Some women don't. Usually, as things progress throughout the pregnancy, you know, things kind of stay stable. And then usually in the first few days after you've given birth, that's when more changes will happen. So usually in or around the third day, your breasts will start producing more milk. So you'll hear the term milk coming in, but there's colostrum in the breast in the first few days, which is like a thick yellow or clear substance. And then usually in or around the third day, the milk will increase fairly significantly, and there'll be quite a bit of breast changes and growth at that time.
Yeah, and there's lots of things that can affect sort of that 3-day mark. So moms that have had a cesarean delivery, moms who have gestational diabetes, moms who have experienced sort of a more rushed scenario in their deliveries, if some kind of emergency happened, then those moms that have premature babies, so moms that I see down in NICU, sometimes all of those factors are compounded. So like the mom was sick, plus the baby was premature, plus it was a really rushed delivery. All of those things can affect your milk supply coming in. So it's not always a straight line, but there are ways that you can get on track if you're having those issues.
And that's one important thing, because a lot of times things don't go as planned, and that's why all of our, I think all of our hospitals and Horizon have lactation consultants who can kind of help bridge that journey and help you. All of our nurses are well trained in breastfeeding and can help with that for people who may have a delayed onset of their milk supply increasing.
Yeah, and if you're having questions, just don't hesitate to ask. Sometimes people are afraid to ask questions. They think that they're silly questions, or they think that we're the experts, but there's a lot of times there's things that you guys are picking up on with your own baby, and so never be afraid to ask questions when you're in hospital, okay? We always want to help you. So we've got a couple other questions coming in. So we have a question from Martin. So she says, hi Martin. My milk flow is too fast for my son and he's choking. How can I help him not choke?
That's a great question. We get that question all the time.
Yes.
And that's kind of, sometimes as the milk flow really increases, sometimes even around that 3rd, 4th, 5th, 6th week after the baby's been born, the milk flow really starts to increase. So one of the first things we usually recommend is laying back or lay down on your side to feed. That's one way to decrease the flow coming out.
Props.
We got some props.
So sort of like a more laid across your body. So the bum should be lower than the shoulders.
Perfect.
And you can kind of cradle the baby in around your arm like this.
Yeah.
I know when I was nursing my babies, that was a really comfortable position, and it also helped with that fast flow.
Yeah. A lot of women, we tend to sit up more straight or lean over our babies, and then that can just kind of create the problem worse. So leaning back, as Christina said, is great, or lying on your side with the baby on his or her side works fantastic. The other thing is, if you're still having trouble and those things aren't working, certainly call a local lactation consultant. Sometimes we can see, sometimes we can help just to kind of tweak the latch and things like that to help things along.
I also find too, especially in my work in neonatal intensive care, so those babies are just learning how to breastfeed, and sometimes the mom's supply doesn't really match what the baby is ready for, and they can get kind of choky. So if you know that you're having a letdown, then you can pop the baby off and get either a warm face cloth or a receiving blanket and just put it under your breast and kind of catch some of that spray initially from the letdown. And then once you notice that that really forceful letdown is done, then get rid of the towel and put the baby back on. And then sometimes that helps them manage their flow a little bit better.
Yeah, that's a great idea, Christine.
Okay, so we have another question from Courtney. Hi ladies, what causes a blocked milk duct and what's the best way to treat it?
This is a good way. This is a good question after our last question. Yeah. So sometimes women who have a lot of milk sometimes can get blocked ducts. So sometimes that's when the breast doesn't get emptied as well as it could. So that is one thing about blocked ducts, is you want to catch them early on. So if you noticed some pain or a lump or redness, that's when you want to catch it early on. So warm, moist heat, massaging the breast, getting the baby to nurse frequently to help the breast empty out. Being cognizant of where you've got your hands holding the breast, and also being trying not to wear things like underwire bras or constrictive clothing that can make things worse.
Yeah, and I find sometimes too, moms will get some relief if they nurse their baby in different positions. So say you're used to kind of like a cross cradle position all the time, then sometimes the baby's mouth is only sort of accessing certain areas of the breast, and it's difficult to empty those other areas. So sometimes nursing in a different position and then doing like some warm, moist heat, like Kelly said, and some really kind of firm massage. I've also had moms who've had success in the shower. So sometimes getting in the shower and doing that hand expression, massaging all the way around the breast. And you have milk ducts really that go all the way up into your armpit. So getting up there and really kind of moving the milk down, anything to get that milk flowing so that it doesn't stay there and turn into a different problem.
Any more questions coming through?
Yeah. Okay, so we have a question from Natalie. How do we know when baby is fed enough, especially when baby is cluster feeding? When do we know that the cries are for milk or just gas?
Oh, okay. So that's a really common question. So generally what I tell a lot of moms, especially in those first early days and weeks, is when the baby goes to the breast, the baby usually starts out kind of with their hands clenched tight and their arms clenched tight, and as they get full, they'll get more relaxed. The hands will open up, the baby will look relaxed, their arms will kind of flop down, kind of like
The milk coma.
The milk coma afterwards. Always assume your baby needs offered both breasts at every feeding. Think of it as the first side is the main course, second side's dessert. Babies have big growth parameters that they usually meet over those first few weeks and months, and so they need to be offered both breasts at every feed. Some babies will also need just even some comfort nursing, and they may not be drinking a lot of milk, but they may be also there just also for some nuzzling, some warmth, or some comfort, because babies don't all they go to the breast for milk, but they go there for other reasons as well, and that's also an important thing to remind yourself of, especially late evening and early night when they want to be close to mom.
Yeah, and I just try to remind moms, like, just trust your instincts, because usually what's happening is you are looking at your baby, and I mean, you know, your first instinct is just going to be to pick them up and nurse them. So it's not necessarily because you know the time from the last feeding or you think that they're still hungry. That's the way that you can provide comfort for your baby and nourishment. And so if you're looking at your baby and they're upset and crying, step one, just nurse your baby. And then if that doesn't work and they still seem like they're fussy, then maybe you're moving on to something else. But especially in those early days and weeks, you know, the baby is just acting on instincts. You can't spoil a baby when, you know, a really tiny baby, when you're picking them up and nursing them often, they're not treating you like a soother. They are working based on these ingrained biological instincts that have been there and have kept our species alive for
thousands of years.
Yeah. And so, you know, in those early days, if your baby is showing cues that they want to feed, then just pick them up and feed them. And it's always preferred to catch the early cues rather than waiting until your baby is crying, which is a later cue. So your baby's opening up their mouth, looking side to side, licking their lips, putting their fingers in their mouth. Those are all early cues, and it's a lot easier for your baby to get themselves coordinated and get themselves ready to feed if you can catch those early cues. I kind of liken it to like being hungry versus being hangry. So it's kind of the same thing with the baby. And once they're at the point where they're really crying, it can be difficult for them to get a good latch. And I always try to prepare moms too, when I'm working in labor and birth, that initially the first day or so, your baby's probably going to be a little bit sleepy. And then on that second night, they really wake up, right, Kelly?
They really wake up.
Yeah.
They may not just want both sides. They may want the first
Triples.
side, the second side, back to the first side again. And they may do that often. Some babies do that every evening.
Yeah.
And that's normal.
And that's normal. One of the problems I think that we run into is that people have sort of gotten away from knowing what normal infant and newborn behaviors are. And it's really normal for a baby to want to nurse many times a day. And it's not even just a young newborn. Sometimes older babies, 6, 8, 10, 12 months old, they have periods of time when they want to nurse really frequently, and that's normal behavior. And it's okay for us to kind of get to a place where you know, we recognize that that's normal behavior.
Sometimes even 3 and 4 month old babies who are starting to notice their surroundings and looking around at maybe an older sibling throughout the day, throughout their feedings. They whip their head off the breast and look at the other older sibling. Sometimes those babies decide they want to, because they're more distracted in the day now, they nurse more at night again, because they all have to get a certain amount of milk throughout that day, throughout the 24-hour period. So sometimes you may notice that they're nursing more again at night, and that's normal.
Yeah. I see Donna Brown has joined us. Hi, Donna.
Hi, Donna.
Donna is our baby-friendly coordinator for Horizon Health Network. She does tons of great work in our network. So hello, Donna. And I see we have another question here from Chelsea. So she is breastfeeding her 20-month-old son. He feeds twice a day, morning and night. Lately, he's really busy while she's feeding him, like Kelly just said. He's popping off and on the breast all the time, and he would rather play and laugh with her than eat. Is there anything that I can do to keep him on task?
Well, first off, Chelsea, congratulations for nursing him for 20
good
months.
for you.
Good for you. You're a champion, and you're an example for so many others. So yeah, at 20 months, probably nursing him in a quiet room is a, you know, before bed, early in the morning, that sort of thing. Can you think of anything, Christina? No.
Well, I would just say that, like, it is kind of that it's part of that natural process, right? So like we said before, breastfeeding isn't just about nourishment. So your baby at this point is probably eating lots of solids, and even though it's still really important to get breast milk, there's still tons of benefits of breast milk for a nursing toddler. You know, they might be treating those feeding times as kind of playful bonding times with you, and not necessarily about like getting a totally full belly. And that's okay, because that's what that progression is, right? Because your baby's not going to breastfeed forever. And so, you know, it's sort of those little baby steps of kind of letting go a little bit. And you might find, like I work with lots of moms who maybe this is the case with their baby the vast majority of the time, but then say your baby gets sick, they get a bad gastro, or they get a really bad cold, and they don't want to eat as much, like they're not really eating solids and stuff anymore. Then at that point, these moms are saying like, oh my goodness, I'm so happy that I'm still nursing, because if I wasn't breastfeeding, this kid wouldn't be eating anything. And at that point, the baby seems like they really want to nurse a lot more. Or even times like when, you know, maybe they're getting some immunizations or like flu shots is a great time to nurse your baby. So it's not necessarily, you know, for feeding every single time, but it can still really be beneficial through those toddler years.
Yeah, perfect.
Yeah.
Sounds like a typical 20-month-old toddler feeding.
Yes. Yeah. It makes it a little bit more difficult to, you know, be modest if you want to be when you're nursing in public, because they don't really care about your modesty. Okay, so let's look through some of these questions here.
By the way, these are great questions.
They are. They're really
We're getting
great
some
questions.
Newborn stuff. We're getting some older baby questions, and some questions that we get asked every day. Yeah.
So there's a question here that I think is probably a universal breastfeeding question. My nipples hurt. Is that normal?
Well, that's a really good question. You know, if most women's nipples are going to have some amount of tenderness, especially in the early days. Yeah. So we like to call that transitional tenderness, okay? So
the keyword being transitional.
Transitional, meaning it's not going to last forever. So often in the first few days and weeks, sometimes when the baby's sleepy, especially in the first 24 hours, maybe he or she didn't have his mouth open quite wide enough and maybe caused a little bit of pain and discomfort. Well, that may take a few days to settle down. So the important thing is that the pain is not getting worse over time. So often around day 2, day 3, yeah, things may be a bit tender. There's lots of things you can do to help alleviate some of that tenderness, but over time, the nipple tenderness should be settling down. If it's been, you know, especially over 2 or 3 weeks and you're still having a lot of pain, that's when you need to seek some probably professional advice at that point from a local lactation consultant or community member.
Yeah,
with
there's
some
drop-in groups,
drop-in clinics.
There's
through somebody with some more experience to have a look at that latch, see what's really going on. Things to help prevent nipple tenderness. Ideally, big, wide latch. Sometimes as newborns, we get pretty good at working at getting them nice and wide, and then sometimes we can just kind of forget about making sure we get that wide latch. So sometimes maybe it's a 6-week-old and mom's kind of gotten more relaxed with breastfeeding. Maybe the latch has narrowed down some. So sometimes making sure that that wide latch is there. And
by wide, we mean as big as a yawn. So
big as a yawn.
When you have a newborn baby, you see them yawn a few times. That's how wide they can open their mouth, and that should be like the width, the wideness.
Don't accept the first open mouth.
Yeah, it can be really tempting because you're kind of nervous and you really want to get it right. And so as soon as the baby kind of opens their mouth a little bit, you just sort of smush them on. But really, in the long run, you're going to benefit from, you know, kind of taking a deep breath, dropping your shoulders, being patient and waiting for the baby to really open their mouth nice and big. And you can kind of encourage your baby to do that if you just rub the nipple a little bit like on the top of their lip, just to sort of encourage them. And you want to be trying, instead of kind of trying to get a bullseye of the nipple right into the baby's mouth, a way to encourage your baby to open their mouth really wide is to actually point your nipple more up towards their nose, because doing that
hand me a baby?
makes them sort of...
Got a couple props here.
Yeah.
And maybe breast too. So if this was my baby, a nipple, if she rubs her nipple on...
Maybe turn to the side this way so they can
here,
see a little bit better.
on the top lip, there's a little instinct there that my baby will open wide. So you can see his mouth is partway open, but not fully. I'm gonna wait for him to open wide, and you can see that I'm pointing the nipple at the roof of the mouth. When he opens wide, I'm gonna bring him in quickly. Perfect. So opening the mouth super wide is important. That's going to help prevent nipple tenderness. If your nipples get tender, certainly things like putting your milk on your nipples after you feed can help, using some warm compresses beforehand, and there's some ointments and things out there if things get really tender.
Yeah, you can talk to a primary healthcare provider about. In general, we don't really recommend, like, you don't need to buy any fancy ointments. There's all kinds of different like lanolin creams and stuff, and some people like to buy them, but we always tell people to keep in mind that they can be sources of infection, because you think those little pots, you're digging your fingers into them over and over again. If it's 3 o'clock in the morning, you're maybe not washing your hands as well as it could be. And if you have a few little cracks in your nipples, then it can be a source of infection. So just be careful if you're using any of those types of creams. I know some people are using coconut oil now. There's lots of different kind of like natural ointments and stuff. But really just colostrum. So like,
is your best bet.
Yeah, so after you're done a feeding, hand expressing a couple of drops, taking those drops, rubbing them on your nipples, and then just letting them air dry for a few minutes can really be protective, because a colostrum has a lot of moisturizing factors, and it also has some antibacterial factors as well. So it sort of kills 2 birds with 1 stone. So we have another question here from Shannon. Hi, Shannon. So she asks if we have any recommendations or recipes or resources to increase milk supply.
Well, the best way to increase milk production is increase the frequency of nursing. That is, babies make milk better than any kind of a pump, any kind of a supplement or medication or anything like that. So I always say increase the frequency of nursing.
And just really make sure that you're optimizing Because sometimes we'll have moms who are pumping and they want, they're looking at different medications or looking at herbs or supplements or whatever, but then we realize, oh, well, they're only pumping, say, 6 times a day. And so often if they're able to bump their pumping up to maybe 8 times a day or even 10 times a day, then that increases the milk supply without even needing to use anything, right?
Yes, so that would be for a mom or somebody who might be exclusively pumping. If it's a baby who's going to the breast, maybe he or she's not nursing as often as the baby was, maybe a few weeks ago. So some moms feel that the baby only needs 1 breast at a feeding, which is not true.
It's called block nursing sometimes.
Yeah, most all babies need to nurse off both breasts or be offered both breasts at every feeding. So that's one way. The other thing you can do is sometimes go back to those first few days of nursing and remember what were some things that the nurse may have showed me or the lactation consultant may have showed me to help increase the baby's milk that the baby was getting. So sometimes squeezing the breast and doing some good breast compressions will also help to increase that milk production as well. So those are some really good ways. I always mention also make sure you're eating well enough yourself and drinking lots of fluid yourself, because sometimes in the busyness of taking care of baby, some moms forget about themselves. So
that is very true. Yeah. And also, if your baby kind of doesn't seem to be queuing as much for feeding, I would recommend doing a lot of skin to skin time. So
go back to the newborn days.
Yeah, exactly. Yeah. So we have a big push. We want, every mom who is healthy and who has a healthy baby to be able to do skin to skin right away at birth with their babies. And keeping your baby skin to skin unbundled just in their diaper on mom's chest really helps the baby helps their instincts kick in and really helps them be able to search for the breast in a really unrestricted way. Sometimes we get into habits of doing a lot of swaddling because it does help your baby sleep for longer periods of time, and I know that sleep is really precious, but sometimes it can also sort of stifle some of those instincts and make the baby a little bit less apt to wake up and feed. So lots of skin to skin time with mom. Sometimes we call it a baby moon, like a baby vacation.
That's
and
what
so
I say, go back to those newborn days.
Tucking yourself in bed with your baby and keeping them skin to skin will encourage them to nurse more. And then beyond that, if increasing their frequency of feedings isn't really helping, there are a couple of herbs we talked about earlier, fenugreek and blessed thistle, that we sometimes
sometimes it's just kind of out there. There are other things. Usually I would say if you've increased the frequency of your nursing, the baby has a good latch, then sometimes, and you're still concerned that maybe your milk production is not what it should be, usually at that point I recommend contacting a local lactation consultant or a community breastfeeding support, because there may be some other things that maybe need to be looked at as well. And because there can be various reasons as to why milk production has dropped down, if in doubt milk production has dropped down. A lot of times it hasn't. It's just things have changed a little bit, and or the baby's behavior has changed a little bit. But always contacting one of us is always great.
Yeah, exactly. And then they can refer you to a primary healthcare provider. There are some medications that can help increase milk supply, but we want to make sure that we're optimizing all of the other pharmacologic ways that we can increase milk supply before then. And sometimes too, it's I'm definitely not discounting the fact that some moms do notice a drop in their milk supply related to a lot of different factors, but sometimes it's also our perception of whether or not that our milk supply has dropped. So sometimes it seems like maybe your breasts aren't as full, but those aren't necessarily indicators that your baby is getting enough. So maybe we could just go through, Kelly, you want to talk about some of the indicators, how do we know that a baby is getting enough milk?
Well, of course, you want to continue to keep a watch on the diapers, okay? Your baby should always be having at least 6 clear, heavy, wet diapers per 24 hours. As for the stool should be yellow. This is beyond day 5. And usually between about day 3 and around 6 weeks of age, the baby should be having at least 3 yellow liquidy stools per day, at least the size of a quarter. Sometimes around 5 or 6 weeks of age, the baby's stooling will drop down to maybe every 4 or 5 days, something like that. But the baby should still be having at least 6 to 8 clear, heavy, wet diapers again per day. So continue to watch that. Also, some things, listen, is the baby actually swallowing at the breast? So listen to make sure the baby's continuing to swallow well at the breast. If you're thinking, okay, baby's not swallowing as much as he or she used to, and you have concerns, maybe the baby's pulling off the breast a lot and things like that, that sometimes is an indicator that maybe give us a call or kind of focus more on what's been happening at the breast. But keeping an eye, and of course growth is important, making sure you're attending regular follow-ups with your healthcare provider to make sure that the baby's growing well as well.
Yeah, and I mean, it doesn't even necessarily have to be that the baby's getting, you know, weighed weekly,
No.
you're looking at, you know, just kind of practical things like, is your baby growing out of the clothing that you're buying for them? Does your baby seem bright and alert? Are they going through some of those changes that you would expect in terms of their development? Do they seem settled or contented after feeding? And have like at least a little bit of a sleepy period? So those are all kind of ways that we're looking.
Content after feedings is a good one. And
Okay, so I think we maybe have time for one more question. So this is from Natalie. So she says, I just stopped nursing my toddler at 21 months.
Good for you.
Congratulations again. And he hasn't, because he wasn't showing any interest anymore.
Okay.
I'm now 35 weeks pregnant. If I wanted to start again because he's sick, is that a bad idea at this stage in my pregnancy? I know my milk is very different as it's getting ready for my newborn.
Yeah, I don't think there's any problem with continuing to nurse again. You're 35 weeks pregnant. You've only got a few more weeks to go. So we would say, you know, do what's natural for you at this point in time. What feels right for you. So there's no concern. There's a lot of moms who are nursing toddlers and also nursing newborns or infants as well.
Yeah, some moms do tandem nursing, and
lots of moms do tandem nursing.
And there's a lot of toddlers sometimes who will come back because they've noticed, oh, there's a new baby here, and this used to be mine, and so, you know, it's really normal for them to want to sort of try things out again a little bit. The milk has changed, you're right, and so an older toddler will sometimes comment that the milk kind of tastes a little bit different, or that the consistency is different, but there isn't, as long as you have a healthy pregnancy, then, you know, there shouldn't be any concerns with nursing at the same time.
Yeah. Perfect. That's a great question.
So we've really enjoyed answering your guys' questions today. Hopefully we'll be able to do this again sometime. So if you guys have more questions, just leave them in the comments and we'll try to get to them. But yeah, this has been great.
It's great. Thank you so much. And certainly, maybe we'll see you guys in the future. Any further questions, put them in the comments. And great to be able to take part in this event that Horizons allowed us to do.
Yeah. Happy breastfeeding.